Mic check, mic check. All right. Good afternoon, everyone. Thank you for being here today. We're having a press conference to discuss the announced restrictions that we have put in place effective immediately last night, but also effective immediately tomorrow at 8 p.m. And how we are taking proactive measures to address COVID-19 in Norman. We have had one case of community spread, and we found out about that last week. That was when it started, and that so far only one case confirmed, and I want to emphasize that. Our emergency proclamation on Friday limited organized gatherings to 250. We closed our senior center. Now that schools have closed, our recreation centers are closed as well. We have continued to follow the best practices and recommendations from the CDC, including President Trump and his recent press conference. And so the immediate change of that was last night. We lowered that number of 250 down to 50 people. I do want to clarify that there will not be a curfew. However, we are putting measures in place to encourage social distancing to get in front of the spread of the virus. And those additional measures include a prohibition on dine-in services for restaurants with no restrictions on drive-through, drive-in, takeout, or delivery. We've also closed bars, lounges, taverns, private clubs, gyms, health studios, theaters, and commercial amusement facilities. Again, those closures are effective starting tomorrow, Wednesday, March 18th at 8 p.m. And at this time, they will last through April 3rd. We will extend it as needed, but we are following President Trump's 15 days to stop the spread. These measures may feel drastic or extreme, but we have a unique opportunity being located where we are in the state of Oklahoma. We have been able to see what has happened with the spread of this virus across the nation and across the world. We also have examples of what works and what doesn't. And so I am so pleased that not only is Norman enacting changes like this, so are so far announced Tulsa, Oklahoma City, and Stillwater. I want to commend the mayors of those cities for also taking strong action in stopping the spread of this virus, because it is these actions from cities and local governments that will help protect our healthcare systems so they do not become overwhelmed like we have seen in other cities, other states, and other nations. Our motto in approaching disasters has always been, don't be scared, be prepared. I have said time and time again, and I will say again today, that it is not a time to panic. It is a time to prepare. It is a time to be aware of what is happening and to treat it seriously. While most people who do contract COVID-19 will not suffer major symptoms, and they will not have to worry about the worst kind of outcome of COVID-19, but there are those that will. And it is incumbent upon all of us to take this seriously and to cut down on the spread so we can effectively flatten the curve, not only in our city, but in our state. So to address further questions about measures being taken in our community, I have invited some of our community partners to join us today. From Norman Public Schools, we have Communication Specialist Wes Moody. From Norman Regional Health System, we have Brittany McGill, Chief Nursing Officer, and Dr. Boyd, the Chief Medical Officer. And we will start with Mr. Moody from Norman Public Schools.
Thank you, Mayor Clark. First of all, Dr. Migliorino wished me to express his regrets that he couldn't be at this press conference this afternoon. He and our entire district leadership staff are hard at work putting into practice our plans to continue to ensure that we continue to serve the students and families of Norman Public Schools throughout this closure. In fact, he's on a conference call with State Superintendent Joy Hoffmeister right now. These are certainly challenging times, and we recognize the hardships that any school closures have on our families. We're doing our best to balance our priority of protecting the health and safety of this community with our desire to continue to provide the services that so many of our students rely on from us. One of the largest issues during any school closure is obviously child nutrition. We know that for many of our students, school is their best and in some cases their only source of food. Norman Public Schools will provide meals to students throughout this closure. We've been working and preparing for this situation, and we've faced similar circumstances in the past. We are prepared and ready to meet this need. We're working right now to finalize our logistics to get these meals into the hands of those who need them. This is obviously a very different set of circumstances than we faced during the teacher walkout when we were able to open our cafeterias to our students. I can assure you that our plans will be in accordance with guidelines from the CDC on social distancing and safety practices. We also want to thank our state and federal officials for granting us the appropriate waivers that we needed to be able to provide these meals. These actions have allowed us the ability to continue to provide the nutrition that is so vital at this time. We also want to recognize that Norman is an exceedingly generous community that supports its public schools to the fullest. And we recognize that there are many people in the community who will wish to help and are eager to provide assistance during this closure. We would encourage those individuals and organizations to get in contact with the United Way of Norman. Norman Public Schools has all the resources and staff necessary to fulfill the needs of our students. However, the strain and burden of this situation will undoubtedly be felt across our community. The United Way and its partner agencies are experts in meeting that need. Their services to this community are not only vital to Norman Public Schools, but to Norman as a whole. So we would encourage any of those interested in helping to do so through them. Again, Norman Public Schools is prepared and ready for this closure. We will provide meals for our students for the duration, and we will announce details about the logistics of those plans very soon. We are keeping our parents and families up to date throughout this situation, and you can view our latest updates, including FAQs, at normanpublicschools.org/health. That's normanpublicschools.org/health. Thank you.
Thank you, Mr. Moody. I appreciate the district's leadership, and I also appreciate the generosity of our community. I do want to take this opportunity to thank all of the businesses and event organizers and everyone that has come together and preemptively canceled things and rescheduled things before we even made our announcement. It will make a difference in our community, and it will save lives. With that, I would like to invite Brittany McGill, Chief Nursing Officer from Norman Regional Health System, to join us.
Thank you so much for having us here today. I'd like to start by thanking everyone within the Norman Regional Health System for their efforts. There has been a tremendous amount of teamwork and collaboration as we begin to prepare for COVID-19. I'd like to also thank our community partners, the county and state level health departments, as they have been instrumental in how we coordinate care. We, too, as a health system, have put restrictions in place to reduce the spread. Those include travel restrictions for employees. We've shut down the dining areas of our cafeterias. We have put visitor restriction policies in place. We have restricted vendors and students from entering our healthcare facilities and turned it into essential providers only. We set up Incident Command, which is a centrally located boardroom type setting within the health system where we have an emerging infectious disease team made up of infection preventionists, clinicians, infectious disease providers, safety and security. So from that one location, we are able to be very nimble and aggressive and progressive in our actions as this situation continues to develop. In regards to testing, we would like everyone to know that we are following the state's recommendation in testing guidelines. You are free to call the state health department to get guidance. We also recommend that you reach out to your primary care providers for guidance. This is a virus. It is a little different from the flu because flu has been around for a while, and so how people respond to this is somewhat unknown. That being said, if you have mild symptoms of this, we prefer that you stay home, stay away from others, and in a safe place as you manage those symptoms. We are seeing and continue to treat true emergencies in our emergencies departments, and we need to be able to continue to do that and not be overrun by mild symptoms. That being said, if your symptoms progress, please reach out to your providers for assistance. We recommend calling before you show up so that those providers can be adequately prepared to get you safely through that flow process. Thank you.
Thank you. And now I'd like to invite Dr. Boyd, Chief Medical Officer, to join us.
Thank you for having us. I don't have a lot to add to what Brittany and the mayor have already said. Follow the CDC guidelines. Do not show up at doctor's offices, provider offices, emergency rooms, hospitals to be tested. Only come to the emergency room if you have an emergency. Use common sense when it comes to this illness. Most everybody will have only mild, if no symptoms, and need to just stay home and manage your symptoms there. call before you go, and the health department will get involved and will be the one to monitor you and anyone you've come in contact with. We have to be prepared for this to get worse, and the biggest step in that is making sure all of our providers at the hospital can be prepared to take care of you. So we can't take care of mild symptoms in our hospitals. Wash your hands, follow all the directions and instructions that you've heard about social distancing, and we will get through this. As the mayor said, it's time to prepare, not panic at this point. Thanks.
Thank you. I would also point out that in this time, we need to acknowledge the fact that cities depend so much on sales tax. And I understand that our businesses of all sizes will suffer during this time, and decisions like what we've made here in Norman and we're seeing across the state are not made lightly. We've done our best to support, again, drive-through, takeout, and delivery options. Our local chamber is putting together a list of businesses that are participating in this. We have other companies joining together to help businesses who don't have that capability to set that up. I've appreciated all of the efforts that all of our community partners have made proactively to address this and flatten the curve in Norman. So I'm happy to take any questions that you have. Yes.
How does this affect hotel chains that might have beverage service, but also obviously a large guest count within their facilities?
That is a great question. We are limiting crowds to 50 at this point. It's my understanding from our city attorney that the definition that we use in our zoning is what's going to apply here, and so it'll be the main crowds. However, while there are businesses that don't fall under the definitions that we have used in our recent declaration, I'm encouraging, if you are able, please close. The sooner that we get ahead of this thing and control it, the sooner we can get back to things as normal in our community. Yes.
50 is the number from the CDC. Just President Trump has gone on a couple times now saying 10 or under is the ideal. Is that what the number is going from?
We're currently going with 50 right now. We went from 250 to 50. We've clearly shown that we're willing to be flexible and make changes as needed. And so right now, our goal with being so proactive with our messaging was to take this seriously. And I'm hoping our residents will see that whether the number is 50, 25, or 10, that now is the time to stay home and practice safe social distancing as the doctor recommended.
Also, why tomorrow night, not tonight? A lot of cities are already doing it tonight with the restaurants. There's been talk that O'Connell's was allowed this. Thoughts?
It's not just, O'Connell's did not get special treatment on St. Patrick's Day, even though if that was the case, I'm sure a lot of Normanites would have appreciated that. However, we were willing to put it into place last night, but we did have businesses ask for time to prepare. I've also had a business owner ask for more time because they have thousands of dollars of food that is not likely going to get eaten now. So that was our best solution, to be accommodating of our businesses, but to make the announcement ahead of time. So again, to put residents on notice that this is to be taken seriously. This isn't something that we chose to do lightly, and hopefully people will start making some smart choices regarding helping stopping the spread of this virus.
Nobody from the county, correct?
That is correct. We're going to have them join us today. They've got their hands full, like most of our county health departments right now.
We've gotten a couple emails at the station. The county assessors were still going door to door for tax purposes. They were worried about exposure, especially to elderly that opened their door. Just thoughts on that, or if that was even on the radar?
That is not on my radar. The census is very much on my radar. What I would tell people is if you don't feel comfortable opening the door, don't open the door. Contact a local official for guidance. The county commissioners are very responsive here in Cleveland County, and I'm sure they will address these concerns as they come up.
And for healthcare people, I want to get tested, not necessarily me, but I'm a resident, I want to get tested. How does that work?
Call the phone number that's on the screen. Don't go to the hospital to get tested. Don't call the hospital to get tested. Use the state health department's hotline, and they will direct you to testing and all the follow-up that's needed.
It is very jarring to hear, we're not going to be able to take on maybe mild to moderate symptoms, and for everyone that is a little bit different. So at what point do you want to see those people start to head towards their physicians?
I want them to come to the physician or the emergency room when they normally would if they were ill. That's not for routine appointments. That's not for mild symptoms. So if you normally would seek medical care at an emergency room, that's still what we want to see. But for anybody who's just got mild symptoms or has questions about COVID-19 or thinks they might have symptoms of COVID-19, we do not need to see you in our emergency department. We need you to call this number and they will guide you through it. That might include sending you to an emergency room. But we need to let the health department manage this.
Is there a certain number of kits or tests that Cleveland County has, and do you feel like the number that's shown up at COVID-19 is an accurate representation of what the county's actually experiencing?
It's difficult to say. Again, I would refer you to the health department as far as the number of kits they have and the testing. We collect the samples and then send them to the health department.
As far as what you've seen locally in hospitals there, just because we aren't testing everyone?
It's difficult to know. I can't give you a number, nor could I if I knew it, if concerning positive cases. But I have to go with what's reported.
Maria, I think to sum up what you were saying is we'll never really know how bad this is if we're taking the steps to not reach that point.
Exactly. I'm sure people have said the words fearmongers or causing panic or extreme, but the goal is to not see that spike. We will know if we're successful with lower numbers, and then there may be some that say, oh, see, she overreacted. I will never feel that way. If we can save one life in Norman, Cleveland County, Oklahoma, all of it was worth it. I will mention in the phone call with the governor that cities and city managers were invited to join recently. He did mention the possibility of drive-through testing, so I know that they're working on that, and that is very encouraging. It's worth pointing out that we're in spring break right now. And it's such a bad time to hit our nation and our state, particularly for a college town. Mayor Joyce and I from Stillwater have had conversations about this. We've both already had community spread, and that was before spring break, before thousands of people have left our community and returned. And so the best thing we can do is be proactive. These non-pharmaceutical interventions will make a difference, and I am incredibly proud of the local leadership that I've seen across the state.
I saw something in Illinois that was, they are going to limit firearms and then sell and potentially even liquor stores. Would Norman ever put anything like that in place?
Ever is an interesting word in that sentence. At this time, we're not considering anything like that. Again, we don't want people to panic by getting ahead of this before the numbers skyrocket. Things don't need to come to that, but we need our residents to listen and to take this very seriously.
Like you were saying earlier, obviously it's going to impact a lot of families, a lot of business owners. When you've been in contact with them, what is something that you said that kind of put them at ease? Obviously they're going to be worried about finances in the coming weeks.
They are. Having been someone who put herself through college by bartending, I have lived paycheck to paycheck. Again, this decision was not made lightly. What I tell them is that, what I mentioned today, the sooner we get ahead of this, the sooner we get past this. I also encourage them to reach out to their state and federal officials and encourage them to do their job. There are businesses and there are people that are hurting, and there's only so much a city can do. If we can bail out Wall Street, I certainly hope we can save Main Street. Any other questions?
Maria, can you think of some ways in which this might be good for society, good for the people once we get through it?
I mentioned earlier that a lot of our businesses are moving quickly in the technological world to offer online delivery and online sales. I know that Chief King, who's running our Emergency Operations Center, has set up online meetings for our EOC team through Zoom. And so these are things and best practices that have entered our everyday life, and I'm confident will stay because they do work better and will make lives easier all the way around. Thank you so much for joining us today. Take care of yourselves and wash your hands.